Hi, everyone. Welcome back to our fourth episode of Dose of Derm, a dermatology guide for medical students. My name is Emma Holjak.
And my name is Iryna Savinova. On today's episode, we will be interviewing Dr. Ron Vender, a dermatologist who currently practices in Hamilton as the founder and director of Dermatrials Research Incorporated and Venderm Consulting. He has participated as principal investigator in over 120 clinical trials, enrolling over 1,000 participants. He is associate clinical professor at McMaster University in the Department of Medicine and Division of Dermatology.
Dr. Vender serves on many high-impact journal editorial boards. He is one of 7 Canadians elected to the International Psoriasis Council and a member of the Canadian Professors of Dermatology and the Group for Research and Assessment of Psoriasis and Psoriatic Arthritis. He represents Canada on several global educational steering committees and has had posters, abstracts, and lectures presented internationally. Additionally, he has published over 160 peer-reviewed manuscripts. Without further ado, we are excited to introduce to you Dr. Ron Vender.
Hi, everybody. Thank you. Thanks for inviting me for this. This should be fun. Yeah, I'm ready. So thanks to everyone who's listened or who joined. I think it's a worthwhile process, and I think it's very innovative of Iryna and Emma and whoever else has worked on this to do this, and hope that you'll get some valuable information.
Thank you so much. We're really excited to have you here, and we're really glad that you were able to take some time out of your day to join us on this chat. We know this will be definitely helpful to a lot of students, and we're excited to hear about your story and your kind of advice in navigating dermatology. So we can get started. Why don't you start by telling us a little bit about your path towards finding and pursuing dermatology?
Sure. I grew up in a very small town in New Brunswick, a very small town. We didn't have a dermatologist. I didn't even know what a dermatologist was. And I had real no interest in dermatology, except for the fact that I liked having my skin, of course. Everyone starts off by saying, oh, I want to be a doctor. I want to go to medical school. And at first I wanted to be an optometrist. So I thought that was good. But then I said, you know what, I think maybe a medical doctor would be good. You always pick something that you have a relationship with in your early life or that you grow up with. I should have been an orthodontist. That would have been way better. It's a lot more lucrative, huge overhead, but I can't work in a mouth all my life. So that was out. So optometrist was cool, but I said, you know what, I think medical school. And so I went to McGill first, and I did science, and I sort of played the odds with medical school. And it was interesting the way I did it, because everybody did biology or physiology. That's anatomy. That's the way you got into medical school. You do biology, physiology. And I wasn't that strong in biology, really. Memorizing stuff was not my thing. I was more of a logical person, and physics and chemistry and was my thing. So I looked at the guide for medical school applications, and they had certainly the largest number of accepted into medical school were from biology, anatomy, and physiology. So that was easy in terms of absolute numbers. However, when you looked at the percentages of biology, physiology, anatomy students that got accepted to med school, that was low compared to the percentage of students that applied from chemistry and physics. So although the absolute number from chemistry and physics was low, the percentage and your chance within that pool was very high. So I played the odds, and I decided I was going to do chemistry. And if I didn't get into med school, I said I'll be a chemical engineer or something like that. So I did chemistry, and I did not finish my degree. And I got accepted to medical school at Memorial University in Newfoundland. And that's where I met my present wife. And I'd never been to Newfoundland. I went to medical school, and dermatology was still not in the picture. We did have one lecture of dermatology. I remember it was a Dr. Hogan. She was, I think, the only dermatologist in the province. And we had one lecture, and I was like, okay, this is boring. It's skin, so big deal. So whatever. And then there was immunology then, and that's when immunology was starting off. We had like IgG and IgA, and there was no such thing as interleukins or anything, and that didn't exist. There were B cells and T cells. And so I got into med school, finished med school, and then I did internal medicine in Toronto. Still no dermatology. no dermatology. I did internal medicine in Toronto, and it worked out. It was different there because there was internship and not residency. So that brings me to my medical school and my residency part of internal medicine. I'll stop there. Let's see what else you have to say.
Wow, that's definitely an interesting story. I don't think we've had anyone who kind of had such a different path to dermatology, although not super untraditional, since you said you got in right away. So congratulations on that. But I guess we didn't realize that dermatology, you did it after internal medicine before, right? It wasn't a direct entry.
That's correct. It was the olden days. So if you think that dermatology is really a mixture of everything, but it's probably closely related to internal medicine. And so you had to do internal medicine before. Some people finished and got their general internal medicine and then applied to dermatology. But that's the way it worked. And it worked that way for gastroenterology, for everything as well. You did general internal medicine, and then you applied if you wanted to do intensivist, or if you wanted to be gastro or resp or cardiology or whatever else that you wanted to do. Ophthalmology was different. That was a direct, and psychiatry, that was a direct, orthopedics, that was a direct, but dermatology was not. It was a subspecialty of internal medicine.
Mm-hmm. That's very interesting.
Very interesting. I was kind of wondering, was it something within that you saw when you were in your internal medicine residency that inspired you to go forward with dermatology, or when did you kind of find out your interest in that?
So that's the hard part, like, again, you're not exposed to derm a lot. And again, being a dermatologist, you're like, okay, it's cool. But like there was something that clicked in. So I did 3 years of no, I only did 2 years of internal medicine residency. The degree was 3 years. Again, I only did 2. I was a very strong medical resident. I had very good patient management skills, very good efficiency. I had very good letters of reference. And I remember being on the ward, and this was the aha moment. You need an aha moment. And the aha moment was we had a gentleman that had terminal lung cancer and developed this, what we thought was a rash on his legs. And we called the dermatologist that was for Mount Sinai in Toronto and asked him to come see this rash on the legs. And he didn't come the same day. Now, to not do an internal medicine consult the same day is a big no-no. You always have to see them the same day because you never know. But he came the next day. He walked into the room, and I was there, and he looked at the legs, and in 2 seconds, he said, "This is disseminated superficial actinic porokeratosis. It's called DSAP." And I'm like, "What is that?" And he goes, "Don't worry about it. It has nothing to do with the chemo. It's nothing to do with his lung cancer. If he ever gets out, I'll see him in the office. You don't have to do anything with it." And I said, wait. I don't understand what it is. How do you know that's what it is? He says, "You see it, you know it." So he left, and that was my aha moment. And I said, okay, that's the guy I want to be. Guy or girl, didn't make a difference. But that's the person I want to be. I want to be able to go to a room without doing any tests or see a patient, and I immediately identify what it is and immediately know what it is. But the cool thing is that nobody else knew what to do. Nobody. He was the guy, the true specialist. Even in dermatology, when you go through internal medicine, you could sort of treat hypertension and hyperlipidemia and diabetes. You could sort of do that. You could take out an appendix if you really had to. You get that in your training. But look at a skin rash or a lesion and know exactly what it is in a split second. Nobody can do that. And I said, that's what I want to do. I want to be the person that is a true specialist that no one else knows anything about, and I know what it is. And I like the quick and the easy. It was easy. It's not that easy. There's books and books in my head. I didn't have a great photographic memory. I wasn't strong in immunology. Now it's all immunology, but I wasn't strong. I didn't have a great photographic memory. But I guess I did, because you start recognizing patterns, and when I teach, we talk about distribution and morphology. That's what dermatology is. It's all morphology, which is recognition, and distribution, which is where it is. And also what was good with derm is it allowed me to think outside the box. It's not always what it is, but what else it could be. And, you know, if someone has an MI, okay, it's an MI, but you better treat that MI, and you better not think, but could also be a PE. And you'll do tests and you wait for the test and ho-hum, but I'm a bit of an impatient guy. So I like to know right away what it is. So I applied to dermatology. I won't tell you how I got in, but I got in. I will tell you, well, I'll tell you that I never did an elective in dermatology. I never wrote a paper in dermatology. And you may say, yeah, that's the olden days. It was, I think it was my letters of reference that really did well. I had a very good interview. So there were, at the time, there were about 265 applicants in Toronto, and there were 65 interviews, and they picked 3. Did I apply? There was a CARMS. Did I apply across Canada? No. Did I apply to other programs? Nope. And they said, you only applied to one and you want to do derm? And I'm like, yep. And they said, why? And I said, because this is where I want to do it. And then they asked me if I would do research. Would you do research if you had to get into derm? And the only thing for research for me was stuff like a bench, you know, like mixing things. I didn't know research with patients. And I said, if I had to, I would, but I really wouldn't want to. And they were looking at me like, who is this guy, right? Like, so I was very open. I was very honest. I was very transparent. I said like it was. I had nothing to lose, you know. If I didn't get in, I'd continue my internal medicine and do something else. So I was very fortunate to be one of the 3 residents for the 3-year program in Toronto. I had excellent training with a very high-level dermatologist in Toronto. But there are excellent programs everywhere. I have spoken and I'm friends with dermatologists that have trained everywhere. And dermatology is not bad anywhere. It depends on how much you see. So that's my story to dermatology. And now I've been in practice for how long? Do you know?
How long?
Now, it's not older than both of you put together, but for sure, I've been in practice for 32 years. That's a long time. And that's why I have gray hair. And that's why I was happy to speak to you so I could share my insights.
See, I'm glad I didn't guess, because those are always trap questions. How old am I? How long have I been practicing? So thank you for telling us and not making us go through the guessing process.
Yeah, and your answers were really cool. I feel like we haven't heard those exact reasons yet for people wanting to pursue dermatology, but it all makes sense, and it's a really cool way to look at the career of being a dermatologist. I think you actually touched on this a little bit throughout your previous answers, but I'll just kind of ask again and see if there's anything to expand. But do you have any advice to current students who are applying or trying to pursue a dermatology residency?
You have to be now it takes a lot of papers and presentations. I wouldn't always work with the same supervisor. I would not use a canned letter that often comes to me from you're both medical students, and from the pre-med students especially, I get a canned letter. Oh, I was great interest, and I reviewed your paper on so and so, and that was fascinated to me, and I wanted to consider more in depth of this subject that you have published greatly on, and it's the same. And then I get another letter 2 weeks later from a medical student, the same letter, just plugged all in. So that's not good. I think that you need I think that it's important to work with, I hate to say it, with course directors. That really helps. Some medical schools allow an easier time to get electives, some don't. And so you have to try and find a way around that without breaking compliance. You have to do what you like, not what you think you like, not what you think you should do. I think you have to think outside the box and try and become innovative, but not too innovative. Sometimes if you're too far, so for example, if you're just going to write an article on artificial intelligence, you can't just write one. You need to be an expert in that. Is one thing. You need to be topical. So right now, diversity is extremely topical, thinking of something interesting about that. A lot of people ask me, do you have any ideas of what I could do with you? And I'm like, no, I want you to think of the ideas. And so they'll send me 3 or 4 ideas, and I'm not scared to say, nope, none of these are good. They've all been done. So it needs to be researched more. I think that you have to have a backup plan, because I've seen students get very, very depressed and disappointed where they put all their eggs in one basket and all they want to do is derm and it's nothing else. So you need a backup. Rheumatology is very closely related to dermatology. It's a very nice specialty. Plastic surgery is the surgical part of it. However, surgeons are one thing and internists are other. I think derms are more internists. I think that doing things like this, being innovative and spreading the word and helping others is a good idea. But, it's very competitive, and you can't tell all of your competitors, your friends, everything that you're doing. So one word of advice is, it's nice to share and it's nice to help and it's nice to be part of a group, but I don't think that you have to tell everybody everything that you're doing. So it's a competition. So if you have a way of eating Cliff Bars for them before you go on this race, then tell someone that you ate 2 or something. It's not lying, it's just strategy. You still have to have some strategy. It's not being mean, it's not being rudely competitive, but it's a competition. And we know that competitors can make other applicants feel bad and feel dejected at some time. So I'd be very, very careful with that. I find that happens too much. There's too much. Everybody does the same thing, and then all the applicants end up they're all the same, So if you have the same 3 people you're doing papers with all the time, and all 3 of you apply to derm, it's very unlikely that all 3 are going to get in. So be careful.
So what I'm taking from this is kind of still supporting people around you and keeping that camaraderie, but maybe diversifying and all finding something unique to specialize in, perhaps.
Correct. I'm not saying be a mean, underhanded competitor, but I'm saying that it is a competition, and it's a very tough competition because the specialty is so great. I'll tell you my saying at the end. I'll finish off with a saying that I tell a lot of people a lot of times.
Okay, we'll remind you. Don't forget.
Okay.
So kind of diving a little bit deeper into your own practice, could you tell us a little bit about your specific practice in Hamilton, what a day in your life or week looks like, any kind of detail that you can offer us with that?
So I practice medical dermatology and clinical research, which is researching phase 2, 3, and 4. It's not bench research. It's like real drugs with real people and real patients, which is very, very cool. I don't do cosmetic. I don't enjoy it. There's other derms that enjoy doing that mostly for financial reasons. Some of them get a medical satisfaction out of it. But it doesn't do that for me at all. I see only medical dermatology, and in the past 5 years, I've changed the scope of my practice. So I see psoriatic disease and skin cancer, and that's it. I leave the rest to other dermatologists. So I used to see absolutely everything, and then you find out over time that, oh, I like to see this, I don't like to see that. And the same way orthopedic surgeons, some do hips, some do knees, some do ankles. Ophthalmologists, some do retina, some do cornea. Endocrinologists, some do diabetes, some do thyroid. So as a dermatologist, everyone thinks you should do everything, and that's not true. You can change the scope of your practice as you wish. Now I work 3 days a week. I used to work 5 days a week, but I work 3 days a week now, which is very nice. On Monday and Fridays, I either do consulting or I work from home, or I do hiking or golfing. And I do a lot of international speaking as well. So today I had Zoom meetings with South America and the Middle East, and so that takes time to build to that. There are different tiers of what's called KOLs, which are key opinion leaders. Some people like to do that, some people don't. It takes a lot of time. Most of my friends are not KOLs or key opinion leaders, but you have to want to do that. It's a lot of extra work. Your evenings are not free. So like today, I'm going to do a lecture in a half an hour or so and it's just something that I like to do. Some people like to work 9 to 5 and go home. I work 8 to 3 and go home. So that's my day. I have very small staff. I run my own office, and that's what I like.
Thanks for sharing that. And so is your practice do you heavily collaborate with rheumatologists?
I do.
Yeah.
Heavily collaborate with rheumatologists, especially, and now even more some gastroenterologists as well. As a dermatologist, you'll collaborate with all types of specialties. A patient's having hip surgery, and the surgeon wants to stop their medication before I said it's not necessary to do that. So that's, a collaborative there. There's nephrologists as well, where people that have renal disease and skin disease. There's transplant patients that I deal with that have a higher risk of skin cancers due to their immunosuppressive drugs. So there's obs-gynae with pregnant patients. If you happen to do pediatrics, I don't. I used to, but I love the kids. I just don't like the parents. You can do pediatric dermatology. There's a lot of subspecialties. There's neurodermatology, there's photodermatology, there's allergy immunology type of dermatology. There's a lot of subspecialties within that.
I really like hearing about that. I don't think we've heard kind of the overlap of everything. I think we know that dermatology presents in practically every specialty in one way or another. So it's interesting to hear that really you do get to collaborate with so many different kinds of specialists and fields.
Yeah, probably because you haven't had a dermatologist as old as me, and that's probably why you haven't heard that.
So something else we wanted to ask you as well is you mentioned a lot of things that you like about dermatology, and we were wondering if there were any things that maybe you didn't like as much, or some of your least favorite parts about being a dermatologist. Are there any negatives for you, or all positive?
But yeah, the worst thing about dermatology are the patients, all the patients. Without the patients, they'd be great. It's a great specialty. That's just a derm joke. And staff as well. So staff and patient, without staff and patients, dermatology is a great specialty. So let's forget about that. You're almost like when you become a dermatologist, you're so rare, and people have always a question for you. So you're almost like a celebrity doctor. Wherever you go, you will be asked questions. So that's a bit of a negative, a bit of a negative thing. So you get asked a lot of questions. Now it can help you. So let's say you're going through customs, and the customs officer asks, "Where are you going?" "I'm going to a dermatology convention." And they may say, "Oh, are you a dermatologist?" "Yes." Then the next question is, "What do you think about this?" "Or what do you think about that?" So it helps you pass through customs a little bit more easily. So that's good. You always have something to talk about at a party, so that's good. But then that's all you talk about at a party sometimes. So that's a bit of a negative. It is a bit of a negative, but it's a good negative because people want to talk to you, but it's not work. It's your life. So you can't say you're not in clinic, but you're going to get asked questions and you have to be nice about it. I mean, you can't be rude, but that becomes a bit of annoying. There are also annoying diseases to see as well. There are diseases of which there's not much that you can do, and the patients are very disappointed or dejected that they've waited maybe long to see you, and there's things that you can't do. We rarely know the cause of anything. So that's a bit of a negative as well. So you have to realize that. And the skin heals very, very slowly. So it's not like taking penicillin for a sore throat and you're better in 7 days. You need to use creams or pills or needles for months and months and months. So it's very slow. So although I like the rapidity of the visits, the outcome of the patient's improvement is usually very slow. And for an impatient person like me, it sort of balances me a little bit, because otherwise I expect things to be better quick, but it doesn't happen. So that's sort of the negatives.
Yeah, something I did notice is that so many things have no cure and are just long-term management. Even things like, I don't know, warts, which, are just feel like something that's super annoying. Sometimes it's there for 10 years on and off, back and forth. And that can be definitely frustrating for patients, it seems, and probably for the physician as well. So, but I think that just means more opportunity for research, right?
That is true. Yep. And thinking of it that way, for sure. Yeah, absolutely.
So we also wanted to know, so you work with a lot of students and at different stages in their career, and we were wondering if you had any advice for medical students currently on their dermatology rotations, and if you have any insight into the best way they can support the team.
I think showing interest in the specialty is extremely important, not being too much of a keener. I think you have to be careful that if you do an elective for a week, it's very short. You can't really tell what's going on. So you do elective for a week and then could you write me a strong letter of reference? The answer is no. 2 weeks should be a minimum. 2 weeks should be a minimum. A month is the best, but not everybody has a month. And I have criteria for writing a letter of reference. It's not just a 2 week or 1 month elective. It needs a little bit more than that, because there's too many people that ask me to do that. But I think showing interest in something, I think that studying before and not bombarding with questions, too many questions. You need questions, but not too many questions. And I think in this day and age, I'll give you one really good hint, is to find out if the derm that you're working with uses an EMR. And if they use an EMR, get yourself a tutorial on how to use that EMR. And that will be really, really good. So the first thing I asked my students is, have you used this EMR? And if they go, yes, then I'm happy. And if they say no, then okay, they'll learn. It's not too hard, but it certainly helps. Like, I'm working with a plastic surgery resident now, and the more that she can do independently, the more that she's going to learn. So she sees all the patients herself, and I review all of them after. And I can do that with medical students as well when they're a strong medical student. Some medical students, when you have an elective, you just know that, this will be a very good dermatologist or a good derm resident. If you can stay, I learned from a dermatologist in Toronto. He told me if you can think that you could be stuck in an elevator with somebody for 4 hours, then you can probably work with them for 4 years. But if you can't stand them after 4 hours because they're annoying, too keen, too much know-it-all, have bad clinical skills, then it's just not going to be a strong letter.
No, I appreciate the honesty. I think that was like a very tangible piece of advice, especially the learn the EMR. I think that's something we can all do.
So on a little bit of a different note, what are some of the things you like to do outside of practicing dermatology, more so for fun? And how do you balance or keep a good work-life balance?
My best things that I like to do is golf and hike. So hike you can do in the winter, golf you can do in the summer, at least with our seasons that we have here. I do like to travel. My wife doesn't golf, but she likes to hike. So I try and balance the time for my golfing and hiking. And in the winter, we try and hike as much as we can. I still watch Netflix at night. And so how do you do that? When you're a derm or you become a physician on independent or private practice, you control that yourself. And there's no reason for anybody to say, I don't have time, I'm overworked. You create your own schedule. So you just have to block that schedule and you just have to say, you know what, I'm taking Wednesday afternoon off. Now, why people don't like to do that is because they say they lose money. You're not losing any money, you're just not making money. So I could work 7 days a week. I could work from 6 in the morning till 6 at night, 7 days a week, and I'd be busy. And yes, I would earn more income, but I wouldn't be happy. So you would not have a good work-life balance. You'd become burnt out. And I don't think it's good for your general health. So you are the controller of your own schedule. And so you just have to control it. So I have a friend of mine, I said, I'm watching TV, I'm watching Netflix with my wife. And he's like, I don't know how you spend it. How do you do the time? Now, first of all, I don't have little kids anymore. So that's a good thing. But if I did, then I wouldn't be sitting and watching TV. But I do at least an hour or two a night. That's not a lot. It's not like I'm binge watching from 6 till midnight. But you make your own schedule.
So before we kind of get to our rapid fire questions at the end, I just wanted to open up the space for any final piece of advice that you wanted to give our listeners. You mentioned you had a quote that you wanted to end on. I don't know if this is the time for it.
Nope, this is still not the time. We will end as the last thing that I say.
Okay, so before we get to that, was there any other advice that you wanted to mention?
No, I think be honest with yourself, and you have to be realistic. I'm in this specialty, and I'm very, very happy that I'm a dermatologist. There's no doubt. Like, I talk to my friends and like we drive to work every day, and I'm like, wow, I'm a dermatologist. How cool is that? And I've been doing it for 32 years, and all I do is skin. It's fantastic. So yes, I think that there's no better specialty than dermatology, but always have a backup. Don't be disappointed. Have a backup.
I'm really glad that even after 30 years, you're still this excited about skin, and you can see skin in a lot of specialties. So it could be a parallel plan.
It could be.
Okay, so let's jump into our rapid fire questions. These are just a few fun questions to have our viewers or listeners learn a little bit more about you outside of medicine. So we have a classic go-to question. Emma can take it away.
It's probably a very easy question to guess, but of course we have to ask, what is your favorite skincare product?
Oh, that's good. You're not going to get this one from anybody. Vichy for men. Vichy for men. So everyone thinks a skincare product has to be for women, and that's not true. This is the one for men. Men do have different skin on the face, especially for the face and the body with a lot more hair. Vichy HOMMES, which is Vichy for men, which is the best men's skincare product anywhere. The only competitor would be Kiehl's, but I think you're paying a little extra for a little bit of perfumey and some extra marketing.
What is the product? Is it face cream or
anything?
Anything.
It comes in a black. Everything's black and red with white writing, with a big V on it, and V for Vender, and that is the best. Any product in that line for men: shaving, aftershave, moisturizer, wrinkle cream, everything.
Well, thank you for the unique answer, and it works out amazing that Father's Day is coming up. But this is not an ad, but still, thank you for the gift inspiration. My question is, what is your go-to drink order? It could be coffee shop, smoothie, and any drink, anything you can not chew.
Okay, so coffee is a cortado, 100%, absolutely. And alcohol, it's really, I have a tie. It's either it's a pisco sour, or a margarita or a caipirinha. So
Ooh,
that's probably caipirinha is the best, but that type of cocktail.
lots of lime.
Yeah, lot.
And then our final question for you is, do you have any pets at all?
I do. I have a rescue cat because it was cool. Someone asked me if I adopted the cat, and I said no. She's a natural biological. She was not adopted. Of course, I adopted the cat, and she was a rescue. She's 3 years old. We're gonna bring her on camera, and
Oh.
we're gonna take a we'll stop the film, and then we're gonna bring her on camera. Okay.
Cut.
Okay, here's a cut. Okay, hold on. This is Rolly Vender, my calico cat. And if you didn't know that most calicos are female.
Oh,
I did not know that.
We did some genetic testing on her as well. We swabbed her gums and we sent away for more chromosomes. Oh, she wants to get down.
That's okay.
There we go. The cats have a lot more chromosomes than 23. I can't remember how many they have. I think it's 31. We did genetic testing on her to find out what her background was. So she was Maine Coon and Ragdoll, and my wife will tell me something else, but I don't know.
Oh, that's interesting. She's very cute. What's her name?
That's
Rolly.
Rolly.
You said Rolly. Yes. Okay. Well, for any of our listeners on Spotify, you should head over to YouTube to get a sneak peek of Rolly. She's very cute.
So I will leave you with this, with my final comment that you waited so long to hear.
Let us have it.
And so you'll remember when you're both our dermatologists, and you're going to always remember this. And when you get enough nerve to say this to other doctors, which is the best to say it to, you say to the other doctors, just to let you know, there are two types of doctors. There are dermatologists and those that want to be dermatologists, and that's it. And you will see that throughout your career. Everybody who's not a dermatologist wishes they were. That's for
You're
sure.
adding a little spice to the episode, some controversy, some heat.
There you go.
Okay.
Thank you.
Well, on that note, I'd like to thank you all for listening and Dr. Vender for being here today and taking the time out of his schedule to speak with us and shed a little bit of advice. And that quote, I think that's one for the books, right? So we hope to have you back here for our next episode. If any of you want to keep up with our podcast or offer feedback on our posts, you can follow us on Instagram and Twitter at Skin Curriculum, or our website, which is www.skincurriculum.com. Otherwise, we hope you enjoyed this episode of Dose of Derm, and we hope you all take care.